This week on The Cone, we are talking about one of the most common conditions I see in older dogs and cats. That's hip dysplasia. Here are the 5 things you need to know.
And now, the vet who is totally hip, Dr. Andy Roark.
There aren't many things that are sadder to me than bright, alert, cheerful old dogs who can't get up and move around because they've lost their mobility. Oftentimes, hip dysplasia is a part of this. I don't want this to be something that happens at your house with your best friend. So let's talk about what you need to know. When we've got a normal, healthy hip, it's a ball and a socket. And the socket is on the pelvis and the ball is on the femur, the leg bone. And they fit like this. The better the fit, the healthier the hip. When the dog is growing, the ball and the socket don't grow at the same rate and they get out of whack. Ultimately, they just don't fit that well. There's not this clear socket that there should be. At first, there's just looseness in this joint. And then as the dog gets older, the joint wears down and continues to get more deformed because of the motion that's there. Then the dog's body and the bones try to respond and they throw up new growns, so you get bone spurs and bony growth. And they're trying to stabilize this joint. That's what the body's doing. But it doesn't work. It just makes stuff worse, and now you've got painful arthritis. As the joint wears down and it gets more painful, the dog gets more lame, they limp, and guess what? When your hip hurts, you're less likely to want to get up and play. And so they don't move around as much, or they favor kind of protect that leg, and the muscles in that leg start breaking down. They don't get used that much, so then you lose muscle mass. So even if they want to be active, it's harder. And so we've got a bad hip, and then we have weak muscles around it, which makes the hip puts it under more tension, which makes it worse, and then the hip makes the muscles weaker, and it's just this spiral, and we end up with these dogs that their joints are bad, their joints hurt, and then they just don't have muscle around it, and it just gets worse and worse and worse, and that's how hip dysplasia progresses over time. Hip dysplasia is caused by both genetic and environmental factors. Genetically, this is something that can be passed down from parents to offspring, and that's why dogs with hip dysplasia should not be bred. They should be removed from any sort of breeding program. This should not be passed on. We should work to eliminate this. Environmental factors that play a role, and we're still figuring out what this role is, but they play a role in hip dysplasia include being overweight. We've got extra weight on that joint, and it adds to that looseness and wiggling, and it causes problems. It makes loss of mobility worse. It's feeding the wrong diet. Big one here. Large breed puppies should be eating large breed puppy foods. Problems with diet and what they're taking in during rapid phases of growth can play a role. Ligament tears, injuries, overuse as especially as young dogs, those can have real problems. Repetitive motion injuries, running, especially jogging, especially on concrete before the dog is grown and those growth plates in their legs are closed, that banging away again and again and again, that can cause injuries that will lead to hip dysplasia. We want to be really careful about that stuff. Neutering is one that we're getting a lot more information about right now. These are all factors that are environmental that can influence whether or not we end up with hip dysplasia and or how severe it is. Any dog can be affected by hip dysplasia, but it's generally the large breed dogs that I keep a close eye on. I'm talking about breeds like your German Shepherd is classic, Old English sheepdogs, Golden Retrievers, Labrador Retrievers, Rhodesian Ridgebacks, Great Danes, Mastiffs, Bulldogs. Those large breed dogs are the ones I really want to watch out for. Now, large mixed breed dogs are also at risk, the same body size and type, so don't blow those guys off just because they're not a purebred dog. It's the body size that I'm concerned about. So what can we do to prevent your dog from having this problem? Well, there's a number of things. First, beware of puppy mills. I know you hear that all the time. Reputable breeders, people who love the breed that they produce, they are all over this and they pay attention to the puppies they're producing and the health of their animals, and they are working to try to remove the genetic components and get rid of hip dysplasia in their breeds. People running puppy mills or just making puppies, they probably don't pay a lot of attention to this, and they're going to let the problem go on. Just one more strike against puppy mills and pet stores if you're trying to get a pet. Second, keep your dog lean, especially as a puppy. Large breed puppies should be getting large breed puppy foods. Even if you have a dog that already has bad hips, getting weight off that dog, keeping them lean, dropping their weight down is going to take stress off of the hips and increase their mobility. So just keep your pets thin, get them lots of exercise, especially starting early on. Third, get regular checkouts at the vet. Dogs that have hip dysplasia, if we catch it early, we might be able to put them on things like special diets or on joint supplements to protect those hips and slow the progress of the disease. Some dogs, especially young dogs, may even be surgical candidates to help address the condition. Talk to your vet about when to neuter your dog. There is new research showing that neutering before the age of sexual maturity may increase chances of hip dysplasia, at least in certain breeds. Talk to your vet about what is best for your pet, given your pet's breed, the specific circumstances around you and your pet, what you're trying to do, and make a decision that is best for you and based on the most current research and knowledge. If your dog is suffering from signs of hip dysplasia, what can you do? The good news is you've got some options. The first thing I always say is get off as much excess weight as possible. I know I sound like a broken record here, but this just makes sense and it's cheap, right? It doesn't cost anything to go on a diet. Get weight off, because if I've got bad joints, I want to hang as little weight on them as possible. Joint supplements like glucosamine and chondroitin may slow the progression of the disease and may also increase comfort as well. Anti-inflammatory medicines may decrease pain and increase mobility. Treatments like acupuncture, massage, and/or laser therapy are showing some promise and may also provide some results. Finally, some patients may be treated surgically as well. There's a couple of different procedures. It really depends on the specific patient and what's going on. Talk to your vet as soon as you think there might be a problem, just so you have access to all your options. And that's our show. Please let me know what you thought of the show in the comments down below. Also, if you have had a pet has wrestled with this condition, tell your story. You might be really helpful to other people. So share that knowledge down below in the comments. If there's something you think should be covered on the Cone of Shame, you can let me know that as well. We're always watching the comments. Until next time, let's be the people that our pets deserve.